Wow, way to throw me under the bus. Thank you, Jenna, for sharing your thoughts and your experiences, and to everyone. I mean, a big shout out to all the volunteers. Thank you so much for all the hard work that you put into making the labs that much more interesting for students, because you do play a big part, and we really greatly appreciate everything you do. I'll let the next set of moderators help introduce our very special guest. And I'll stop talking once again.
Alrighty, thank you. I'm Robert, and Emily will be joining me as the moderators for this sort of session. And so I'll leave it to Emily to introduce Dr. Bruce Wainman. But he's just going to give us our keynote address and looking at the different undergraduate opportunities. As you know, there are many throughout Brock, but the different undergraduate opportunities there are in anatomy education and research. So without further ado, I'll pass it over to Emily to introduce Dr. Bruce Wainman.
Okay, so Dr. Bruce Wainman is a PhD, is a professor of pathology and molecular medicine at McMaster University, and the director of the education program in anatomy and the surgical skills laboratory at McMaster. Professor Wainman researches the role of augmented and virtual reality on learning, interprofessional education in anatomy, course evaluation using Q methodology, and the ethics of body bequeathal after medical assistance in dying. He is a National 3M Teaching Fellow, a Fellow of the American Association of Anatomy, President's Award winner for Educational Innovation, and a multi-year winner of the MSU Teaching Award for the Faculty of Health Sciences. And we are so excited to have him here today. So I will hand the floor over to him.
Okay, do I have control of the of everything now? I'm not quite sure.
I believe you should, but if not,
Okay.
let us know.
Hi, everybody. I'm going to bring up my talk in just a minute, and I'm certainly happy to see everybody. Thank you so much for the invitation. I was very happy to hear from Dr. Mezel and Dr. McPherson, who invited me to give this talk. And it's I usually say it's great to see all of you, but all I can see are your initials. They look charming, but I'm sure I've actually seen you because I pop into Brock every once in a while. And I did want to bring up the fact that I actually have my own. This is there's my name on it, and there's my Brock Badgers thing. My daughter was a graduate of Brock and also did her master's there. So, and of course I have a lab, and so many of you have been fortunate enough to work with many of your instructors in the medical lab that I run there, medical anatomy lab that I run there. So I know I was told to speak specifically about the role of undergraduates in research, but of course I never do really listen. I think because I'm just old and grumpy, but I do have a few things that I wanted to say, and one of the problems is that I do tend to rattle on, and so I'm really counting on Dr. Mezel to prod me if I get going too long. I think I have about 45 minutes, but there you go. So I'm going to share my screen now, he says with confidence, and I can get on with my talk. So with any luck, you are seeing a picture of my first slide. So someone should probably confirm that you can actually see that.
You're good.
There we go. I feel so much better now. That's excellent. Okay, so obviously that's me. I look very well groomed there. That's normally what I look like. That's my Brittany Isla, who's my co-producer of all things. And she's actually sitting right next to me now. You get to know a lot about people during the time of COVID. A lot of people have met my dog as well. There you go. Okay. So I'm here because I obviously have a long interest in anatomy, and I was going through some pictures recently, and I just had pictures of me and the students at the meeting. One of the things I noticed is there I am in the back. I'm only one part of a really small team, and it's made up of a lot of different people in the lab. These are my research team, and going to various meetings and that sort of thing. What I think you should find interesting is all those red arrows are pointing towards undergraduate students. And And of course, I'm the one with their head in the obturator foramen. But the point is that I have a lot of undergraduate students, and I've always worked with undergraduate students. And I obviously educate undergraduate students. I mean, I hope I do, but they're a huge resource for me, and I've used them for many, many years. So I'm going to talk about how have them as a resource. And also, I want to tell you just a few things that I've learned after teaching anatomy for about 30 or so years. So one of the things is that people think that anatomy is a very old-fashioned and traditional sort of thing, but it's actually a center of technology. I think many of you, especially people in the community, imagine, we're sort of like this, doing the dissections. Or even worse, they imagine us like this. I always love this one because I'm assuming this is the anatomist, and they're running away after, trying to procure this poor soul's body for anatomical dissection. I mean, I have to say anatomy does have kind of a bad reputation sometimes. But to be honest, really, anatomy is more like this, fantastic new educational resources like the different types of learning tables, different, obviously huge numbers of apps, augmented reality apps like these ones that teach you radiology in 2D and 3D, lots of 3D materials that we've developed in our lab. And if I had way, way more time, I could talk a great deal about all the virtual anatomy and augmented reality apps and innovations that we've come up with and that we've been experimenting with. But in fact, anatomy really is a center of anatomic, not just of anatomic innovation, but teaching innovation. And the reason for that, I think, is a little bit complex. I think if we talk to people outside of anatomy, they often think that anatomy is mostly, I call it bird watching. Oh, there's a sartorius. It's just like they would say, oh, there's a bluebird. But that's not true. Anatomy is really about the structure of the body and health and illness. And that is actually a pretty complex thing. And it's not just knowing the names of the structures. Just because you know the name doesn't mean you really understand. And in all the years that I've taught, and I started, and I just should point that out right away, my first experience in teaching anatomy was a neuroanatomy tutor back in Laurentian in about 1981 or something like that, when most of you were oocytes. And, it was a really transformative thing for me. And my first tutoring job as a master's student was actually in the McMaster Anatomy Lab. And I've been around sort of ever since. And so anatomy for me, and I learn new things every single day. Even though I've long ago learned the names of the structures, I'll never learn everything there is to know about anatomy. And when someone says, well, tell me all the names of the muscles and bones, it's a little bit like saying, oh, Shakespeare, it's just a bunch of letters. How hard can it be? Well, obviously, Shakespeare's more than letters, and anatomy is a whole lot more than just the names of structures. Now, having said that, one of my favorite quotes is "Nomen si nescis perit cognitio rerum," as I always put in Latin. It makes me sound so learned. But really what it's saying is that if you don't know the name of something, then the knowledge of it perishes. So I'm not telling you don't need to know the names. Just like reading Shakespeare, well, you have to be able to know those letters. But the point is that it's not everything. And the other thing I want to point out, and why I'm so excited when I started to work with Dr. McPherson about getting the anatomy lab more accessible for students at Brock, is that relevant anatomy really doesn't necessarily come from books. It's a good place to start. But if you look at the anatomy in books, you'd think everyone you're going to ever see is this young, hypertrophic male mesomorph. And that's certainly not true. Many of you are probably interested in healthcare. And if you look at the lifetime use of healthcare, all the money that goes into it, maybe 30% of that is actually spent in the last year or so of life. And so real anatomy, the kind that's really important, is really focused on the elderly. It's actually focused on all the changes and differences that we see. And so in the anatomy lab, you actually get to see those. I mean, if you look at the nice picture from the TEMA Atlas by Anne Gilroy, who's a great anatomist, this is the picture. And that's really what it is. And that is, in fact, a very muscular cadaver, if you will. Even worse, though, is you see living anatomy things. And I think, wow, that's a massive, strong leg. So if you're interested in healthcare, unless you happen to run into, a bus flipped over and it was full of the rugby team, you're not likely to see muscles that look like that. They're going to be, small and thin and more relevant, I would say. Another thing that always drives me bonkers is when I look at vessels, blood vessels in books, they're never where they're supposed to be when you dissect. And those of you who've done that or even looked at the prosections in the lab, you're like, where is that vessel? It was so clear in the book. So you get a picture like this. Again, I pulled one from TEMA because I think they're a really great atlas. But when you look at real anatomy, you see this and you're like, wow, that is a lot harder than I thought it would be. I mean, there's the aorta. First of all, it's all lumpy and bumpy because it's probably got arteriosclerosis. And look at this. This is the common iliac. And it's coming down here, and there's the internal iliac, and it takes this big right turn. And there, look at the other side. It's all over the place, right? And that's the real thing, right? That's what you're going to see. So if you ever become a clinician, you want to know where things are, this is it's about the most useless thing ever, right? Maybe it's a good start, but real anatomy is looking at that. And there's lots of vascular changes. We see blood vessels, and everyone teaches that they're lovely and smooth like this. And this is actually a aorta from a newborn. But this is what they really look like, especially when you get to be my age, right? They're all full of atherosclerotic change. And when you do x-rays, you see, oh my goodness, there's all this calcification here and there. But that's actually what people look like. And you don't very often get the chance to see that in a book, but boy, you sure do in the lab. And that's very serious now. We're beginning to actually occlude the iliac artery. So that person is going to have some problems. And the other thing I want to point out to you, and this is never obvious, is that anatomy is particularly critical now, early in your education. And the reason for that is that when you get further along in your training or out into the work world, one of them is you're not really going to have much of a chance to learn a lot of anatomical concepts, particularly if you go on to OT and PT or MD or any of these different things. And the reason is that they've taken a lot of anatomy out of these programs. And, I'm mostly acquainted with medical education. And before about 1950, there were 1,400 hours a year in anatomy education. Many of you don't know the significance of that. That means that about 90% of medical school was anatomy. Like anatomy school was, or medical school was anatomy school and vice versa. That's what you did. And lately, we're down to something like 150 or 160 hours of gross anatomy. And for some of the anatomical sciences, it's really low. Things like neuroanatomy are down around 60 or 70 hours. And look, it's continuing. These are year-over-year changes, and it's still decreasing. At least it was to 2016. We've actually kind of flattened out because there's a real minimum amount of anatomy that can be taught in a medical school and have people competent. What's the upshot of all this? Well, first of all, if you don't do that work now, you might have a really hard time later catching up. It's just there's just not a lot of time being dedicated in many programs. And I think the other thing to keep in mind is that anatomy continues to be the basis of a lot of training coming later on in life. It's not like the kidney and the structure of the kidney is some obscure concept. It's a real thing that you can look at, and it's useful not just for professional training, but it's useful for life. I could argue that knowing what you're built of is a pretty fundamental thing to know for all sorts of different reasons. And it really doesn't matter if you can become a clinician. It's just important to know how you're put together in the most basic way. So we've been fighting these trends, but it is one of those truths. And I even see it a lot because I do a lot of postgraduate medical training. So people doing surgery and such, and they graduate from their undergraduate medical education, and they're quite incompetent in terms of knowing what they're cutting through and what they're cutting into. And that's fairly unsettling. So all that happens is that they just delay their anatomy education until they're so busy as medical residents that they don't really have time to learn. So it's a really difficult time, but you can forestall all that by taking it all seriously now. Another thing people don't think about for anatomy is it's actually a great agent for social change. And I know I am getting straying a little far from what I said, but I just think this is just so important. And, people, there's so much talk about race relations and so many issues that are going on. And the one thing about anatomy is it really does teach you that color is skin deep. Here's a nice micrograph, and if you look, your epidermis, here it is. This is about 1 millimeter thick, and right at the stratum basale, there's our melanocytes. So all of that business of what people's color is and all the nonsense they make about it is determined by this 1 millimeter with a few keratinocytes here. And it just emphasizes how truly stupid these arguments are often about race and why people are so fundamentally different. I can tell you, 1 millimeter in, we're all the same. And I think that's an extremely important concept to remember. And as anatomists, right, we know that and we see it every day. I think another thing is that it does allow us for a deeper understanding of gender and gender politics and are really, really important and becoming more important every day. And I thought I would just give you a quick illustration of why anatomy is could be useful in social change understanding this sort of thing. When I teach anatomy about how people develop in their primary and secondary sexual characteristics, I usually make this kind of a diagram. And this is supposed to be the undifferentiated ovary. And if you have an XY phenotype, often that will end up giving you more of a male look. And all that happens really is that really at about 5 weeks, what happens is the inside of this indifferent gonad is going to develop quite extensively, and it's going to go further down into the pelvis. And that's really has a lot to do with the production of something like anti-Mullerian hormone and some testosterone. And then that's kind of what you get. So it's pretty complex genetic and hormonal change. And so we're all, as you guys all know very well, right? We're all different genetically and we're all different hormonally. And so how that happens and how rapidly it happens and to the extent that it happens is quite variable. And even in the female, all that happens is that on the outside of that indifferent gonad, that's the part that develops. And this system, which is the Mullerian system or the paramesonephric system, that's the one that develops. And then those gonads are going to descend, and we end up with more of a what we call female phenotype or an XX genotype. So that's what's really happening. And on the outside, again, under complex genetic and hormonal control, at around 5 weeks or so of development, we have this little genital tubercle, some labioscrotal swellings, and in the middle, urogenital folds, and there's a little sinus there. Now, the only thing that happens is if tends to happen is if you have the exposure to testosterone at that point, that genital tubercle is more likely to become a penis and less likely to become a clitoris. The labioscrotal swellings are more likely to become the scrotum rather than labia. The urogenital urethral folds are going to form up differently, et cetera, et cetera. So it's pretty moderate changes that are going to happen at 5 weeks. And so in males, it kind of looks like this. You go like this, and those labioscrotal swellings swell, hence the name. And this little sinus here is going to close up, and this tubercle becomes more like a penis, and this part here just becomes more like gonads. And that's it. I mean, that's really all that's happening. And so obviously the genetics of this are a little bit complex, and that drives the hormonal changes. So often we end up with someone who's, clearly going to be more of a male phenotype and someone who's more of a female phenotype. But quite often we're going to end up somewhere in between with characteristics of both people and both genders, if you will. But let's have a look at it from a real more rigorous point of view. So if we think of what feminine means, it's XX, and ovaries are more of a feminine phenotype, right? More of a feminine appearance, and then also identifying as female. And then if we went all sort of to the other side, we would say, oh, there's XY with testes and more of a masculine phenotype. Whatever that means, right? That's actually kind of complex. What does it mean? Bigger muscles, more hair? Who knows? And then they sort of self-identify as male. But if you think about it, most of us are somewhere in between here, right? Sure, most of us are either XX or XY, but some males look a little bit more sort of feminine looking. Some females look a little bit more masculine. Some people identify as female or male. And so, in fact, gender is a continuum. It's an anatomical continuum. And so we could look at it as basically, and this is hermaphroditus. In the end, it's a continuum of sexual development, and we're all somewhere in between. So why is that important? Like, why would that cause any kind of political change? Well, one of the things is it rationalizes this. And so we understand, if we make the effort, we understand what's anatomically and physiologically happening and why those things happen. Think about how profound that is. It depoliticizes the argument. It's not all about all the sort of vehement and poisonous discourse that happens around people simply because of their genetics and hormonal changes. So we depoliticize it. And then if we're lucky, then we normalize it so people can feel comfortable in their own skin, because truly, as rigorous physiologists and anatomists, we would know that everybody is on some scale of continuum in gender. And so I just wanted to bring that up because it's just a few of those things that I found really super important in all the years that I've taught. So I hope that was helpful, and I would enjoy any questions you might have about it afterwards. But why am I here? I'm sure Yasmin and Rebecca are thinking, God, get to the point. Well, I'm here to talk about undergraduate research and working with undergrads. And one of the most difficult things is actually to change faculty member attitudes. So I'm going to talk to the few of the faculty members here. And it's really hard to change your mind about using students or having students work with you in the lab, because you have to see them not as a resource, not as a burden. And I know that sounds terrible, right? Well, we can't be a burden. Well, sometimes, but the truth is that they're fantastic for course development and certainly in research. And I'm mainly going to talk about research. And the reason is lots of reasons to do that. One of them is it really enhances student life. Just like being a teaching assistant is a huge enhancement of your student life. It really is great. And the other thing is, because it's an enhancement, and students tend to be really motivated and have great work capacity. And that's a fantastic thing. And that's another thing that's helpful to faculty, to explain to them how great that can be. And the other thing is that just having students working with you all the time, especially undergrads, really enhances your life. So you get to work with some students like mine, which are complete nuts sometimes, and you can see them having printed up some 3D modules. And as often you do, you take the sphenoid sinus and make a hat out of it. And this one, this is actually a vertebra. So I think it's some sort of helmet that Jack has on there. But anyways, they're great fun to work with, and I love it. So I thought I'd show you a couple of studies and what the students did. So this actually started from the students. It's an education project. Many students have a terrible time looking and learning their neuroanatomy. And the part of the reason is because if you look at most brain slices, they look like that. And someone says, and I agree, they say, how could you tell the difference? It all kind of just looks like chicken. And so we developed a method of staining it. So look at that. All those gray things are now bright, dark blue rather, and you can see much more contrast between them. And we were pretty excited about this process, but we asked ourselves, really, does that make any difference? Right? It's one thing to say it's going to be better, but does it make any difference? Now, I think most of you would say, yeah, of course it does. How can making the structure more clear not help? Well, you can think that, but until you test it, you don't really know. So how did we test it? Well, we developed something called the brain stain study to look at the difference between these things. And it took over 100 students. Some of them learned in transverse coronal, some learned in transverse stained and unstained. And then we took them and then crossed them over. So they were two groups, transverse stained, coronal unstained. I don't need you to memorize any of this. There's no test. I'm just showing you that even a simple thing like trying to tell whether or not darkly stained brain sections are different than lightly stained brain sections is actually a pretty difficult thing to do. And it took lots and lots of participants. Every participant through here It took us about 2 hours in the lab to put him through the testing protocol. Well, that's hundreds and hundreds and hundreds of hours. And this design, and this is a pretty complex design. And so it took a lot of time, and it actually went over 3 different days. So it's not just 4 hours, it's more like 1,200 hours of work to get this done. Now, I could not possibly ever manage that in that sort of time. But if you've got lots of great students working with you, you can. And so what did the students do? Those students, 8 student researchers, undergraduate student researchers, over 2 years worked on this project. And they did all sorts of things, including helping with study design, fantastic for recruitment. They were our beta testers, and they even helped with the analysis. And so all of that stuff over 2 years, and we got this fantastic research protocol. So it really worked out well. Here's another one. Like I said, if I had lots of time, I would talk to you about lots of virtual and augmented reality learning. We did studies looking at HoloLens. So that's the HoloLens on that's Lily Wallach. That's Lily, and this is what she was looking at. It always feels stupid, by the way, showing virtual reality on a 2-dimensional screen in PowerPoint, because what I'm showing you here is what's like inside of her brain. That's not what's in the environment. But we were just testing that versus that model that we scanned and rendered out in VR, and then on against an actual physical model, and we tested that out. And we also developed one and put it in the HTC Vive. Here's Lily again, but this is a Vive headset, so it's a pure virtual reality, not the HoloLens, which is augmented. So that's what she's looking at and tested against that. And these are all pretty simple studies. I'm a pretty simple guy, right? I design studies that are pretty straightforward, but this takes hundreds of people, and you've got to test them for all sorts of things like their stereoscopic ability and how much knowledge they have anatomy before they come. You have to put them through all the different tests that we have to figure out if there's going to be any real change. We even did virtual dissection. So we made a physical model. I love this one because it's 3D printed. And this part of the model is actually made, with a sewing machine. And some art students work with us on that. It took almost 5 years to develop this whole specimen from start to finish. And so the physical model, you can just sort of take apart and build. But then we built one in virtual reality. So we scanned all of them, and then we tested them in virtual reality. And that was a whole other study that we did that got published. And that took, all sorts of time. But having all the students running people through protocols is what saved us in the end. And so that's how that study went. And right. And here's one of my students, and she's gone on, I think, to do biomedical communications at University of Toronto. She just emailed me recently that she's going out, and apparently COVID doesn't really bother her because illustrators work at home a lot. So she's been doing that. Anyway, I went through and I wondered, like, how many students did I actually put on here? Oh, that was Katrina that we just saw. These are some publications that I put out just on those issues. And here's some publications over the years. And all the red ones are actually the undergraduate students as co-authors, even as a first author in many of these studies over the years. So they actually got on, and this is anatomic science education, which is probably not something that you have, on your bedside table that you read every night. But it is the leading journal for this type of work looking at anatomy. And this is medical education, which is in fact the leading, medical education journal in the whole world. So we're pretty excited about getting all those publications. And for these guys, this was awesome, right? This is something that they could write on their CV that they had accomplished. And everybody knows that a publication in a leading journal is gold. And not only that, it shows up in media, right? This is a global news, and this went around the world as a press release and got picked up by all sorts of newspapers, and this is a medical net. And this was like an awesome moment for me. I was on Science Friday. So if you're a science geek like me, Science Friday from National Public Radio is like, well, that's pretty cool. So I was geeking out seriously. And what we did here was working with a friend that I met at an anatomy meeting who was into parrot anatomy. Seriously, the anatomy of parrots. And he had developed a technique for injecting parrots. And I said, well, gosh, that would work great on people. And so we went ahead and did this project, and then it got picked up. It actually won an award in England as best medical illustration or medical art of the year. So you never know where these crazy projects will go. And incidentally, the work that we did in the lab with humans was mostly done by undergraduates working in my lab in the summertime. So how many student partners? You're probably wondering about that. And I was too, because I don't really think of it. I don't know. I just say, find them. And I ask them if they're dedicated and they really want to do the work and they're willing to make the sacrifices necessary to do something really good. And as I just sign them up. And so sometimes I have as many as 15 or 16. So I decided, well, I'll look at all my publications in 2019 because that's all done. So I picked them up. So these are all my publications in 2016. And look at that. All those are undergraduate students. Those are all the undergraduates that I was working with. So that was some of 2019. And here's some more from 2019. And these are, again, all the red ones are all the undergraduates that were working with me and putting together stuff for meetings and publications. And this is also 2019. So there's a bunch of different students, and sometimes students would get on two different projects if they were fortunate. And so I added it up. So I had something like 16 pubs that year and 58 co-authors, but 36 of them were student partners. 36 of them were undergraduates in second, third, and fourth year. And so 62% of my co-authors turned out to be undergraduate students. And why am I so keen on this? Well, part of it is that I've never quite understood courses where we do so many case studies. And because I think there are so many real studies to be done out there. Like, why talk about research when you can do research? And when you do real research, nobody's going to invite you to talk about a case study that you did in class, but you can present at local, regional, and national meetings if you've done proper research, right? There's always the potential for publication. We don't always, publish in a leading journal with everything that we do, but we've been pretty lucky so far. And of course, if there's a potential for publication, if there's a potential for presentation, and the potential to really learn something, students are amazing. I mean, the motivation level kind of goes through the roof because of that. Not just publication, but the course credit. It turns out, though, that the thing that really gets students excited is travel. I think so often that's one of those things that gets people really excited. And I think I know why. This is the AAA meeting in Orlando. And so I brought, well, that's some of them. I think that's 12 of them. These are all undergrads. Yep. And so they got to go to Disneyland after the meeting. So I'm not sure that was the most scientific thing that we ever did, but I thought it was great. I actually drove them there in the van that we have to rent because we have so many people. And so they thought, well, we're still working. So they took a picture. They took a picture when they were out in one of, I don't know what it was, which of the lands of Disney they were at, but they said, okay, we're working really hard because we saw this and we thought it looked like the pelvis. And so they labeled this tree to look like the pelvis and sent it to me to prove how hard they were working when they were at Disney World. I wasn't convinced, but this was certainly a great bunch of students, and they really do enjoy working together and traveling and getting to know each other. But undergrads are different. They're not the same. They're certainly as bright as graduate students. And I think the graduate students that we have on the call will say, yeah, I wasn't a different person when I started my master's from the year before. So you're bright. You're bright. It doesn't matter if you're in second year or if you're got a PhD. One of the things is that most undergrads are almost completely ignorant of research design and execution. And that's not a slam, right? You're ignorant because you haven't done it. There's no magic, right? You either do it and learn, and so you have to do it to really learn it. So and you think that's bad, but it's not. It's actually a great thing because it's challenging to teach people and be rigorous in your own design when you're trying to teach it to other people. And though they lack the research skill to design everything, they don't lack energy or intelligence to execute the work. So that's what you really need. Like, I can help you design studies and I can find the resources, but I don't have the energy to be able to do all that. I don't have that work capacity and the enthusiasm required. And the other thing, and everybody tells me, how do you work with so many undergrads? They don't really know anything. The truth is that the fact that you're ignorant of that field is great because you can ask questions that are so fundamental. So I have a what I think is a really good example. We were doing a project that we're just publishing now called Size Matters. And it's a very simple project, like all my projects. And it started because of one single question from one of my undergraduate researchers. We had scanned up a bone that was pathological, and it was the scan was fantastic. I bought some 3D printers, so it was all pretty groovy to play with those. And I had hired an undergraduate partner was a software engineer, in computer science type. And he comes to me and says, "Oh, I've done the scan and I'm looking at it. It's unbelievable. It's just like I can see every pore on the bone." And he says, "Well, I'm going to put it in the 3D printer." And he says, "What size would you like?" And my mind was blown. And why? Well, to me, anatomy came in anatomy size. Like if you guys said, "Print me a femur," well, it comes in femur size. I don't know. And so it challenged my entire view about how big an object has to be to learn from it. And so we started this whole project of printing things in different sizes to try to figure out, is bigger better? Like most people would say, yeah, it must be better. But 4 times better, 10 times better, 4 times bigger. Who knows, right? And so and that was all because one student asked me that question. Like, I just presumed they were going to make it the size of a bone, the normal bone, but they just said, "No, well, we can print it any size you want." And that got me thinking, wow, we've been looking at all this virtual reality stuff. We can make those things as big or as small as we want. And what effect does that have on cognitive load? And what effect does that have on learning? And that was all sparked because a student asked me what I thought was like a question I couldn't ask, right? Because they were ignorant of my background and all my years of teaching was regular, normal size material, I couldn't even think about that question. And yet they saw it right away and said, "Oh, what size do you want?" Mind blown. And we've been doing research on it now for like 3 years. Okay. And the other difference between undergrads and graduate students. So an undergrad has very relatively small amount of autonomy because they need a lot of direction. So they're quite dependent. And as we go through the difference in years, when you go to your master's, you're a little bit more autonomous, a little less dependent until you get to be a postdoctoral fellow. So you finish your PhD and you're going to work in a lab and you're really very dependent. You're not very dependent and you're very autonomous. And in fact, you're probably at this point helping undergraduates and master's students get their work because you're so autonomous within the lab. And so if you think about that, they're quite dependent, which is great, right? I mean, that's the way you are. You can't possibly know everything until you've had a chance to do it. So you have to realize that. And so as an instructor, what I try to do is to use what I call the PI method for student success. And that one of the things is preparation. If I'm going to design a project to give it to undergrads to run, I have to chunk it, right? I have to put it into the appropriate size. So I have to think of a project and then break it down into the right size bits so that students can do it. And the other thing is I have to talk to the students a little bit beforehand and say, what are your goals? Like, what do you want to accomplish? And how does that mesh with the research goals? So my research goal is publication. Does that intersect with what you want to do? I mean, if it doesn't, then maybe we should not continue. Maybe I should try to help you or get you onto a different type of project. It's not necessarily research oriented, right? Because there's lots of other projects. I run a pretty big lab, so we always need people doing other jobs. So that's one of the big things. So that's all preparation. The other part of PI is insight. I mean, you're working one-on-one with the students, so you have to, I think, give them some real insight. And a lot of it's just experience. Like, when I was your age or 20 years ago when I worked on this study. That's great because that's your insight. And, the students can find the facts. They can read the same papers, but they don't know the people, right? Often I'll read a paper. Oh, that person, I know all about what they're doing. And so you give them insight. And that's what I think students, I hope anyway, students are looking for, not just the facts, but our insight into those things. And the other thing is enthusiasm. That's kind of the magic ingredient. When you're describing a research project, and if you're not excited about it and not interested, then how in goodness name do you think the students are going to be interested? like you guys are trying to just figure out what to do. And if the faculty member can't even get interested in the project, how are you supposed to feel interested in the project? And so I'm lucky. I'm pretty enthusiastic about most of these things. And so that's kind of the three things you need for projects to go well. And if I follow those, usually it goes well and everything stays on the rails. The other thing is managing student projects. I find that it's really important to have a super clear hypothesis, like on that Size Matters project. They're pretty clear, right? Does it help if it's bigger? That was a question. And, that's good. That helps. Nice clear timelines, like, okay, we're going to beta test for these 3 weeks. You got to make this model in the next 2 weeks. We're going to start recruiting in 4 weeks. That always helps. I think people work well to timelines. Nice clear direction, like you did that well, and I need you to do this in 2 weeks, or you did that badly, redo it. I think I always tell people, no matter what I tell you, it's not personal. It's just about the research. And that helps. My clear direction comes because I'm a very clear communicator, I think. And that helps because, students are very nervous often around faculty members. And it's hard because faculty members don't feel that way. Like, we were all students, why we don't think we're intimidating, but often we are. And so I spend a lot of time telling students, silence is not acceptable. Nodding your head at me and just saying, yes, everything's fine is not acceptable. You have to tell me exactly whether you get it or not, because we've got to do something important and great here. And if we don't communicate clearly, it's not going to happen. Repetition is key. I normally will give students, have a meeting, and I will say, okay, now tell me, what are the goals that we had from this meeting orally once we finish, so that everybody's clear about what we're going to do. And then we have an action plan for every item. Like, next week, you're going to come back with the application to the Ethics Research Board. I'm going to look it over and I'm going to submit it under my name, but that's what you're going to do in 2 weeks or next week or whatever. And you get used to it, and then everybody's happy, right? Because it's not vague. And then I always try to make sure that the students know that you're a provider of resources and a partner. And that's kind of the way I see my job, right? Is not as the commander, right? But just I try to provide those things that you need to get the research project done. And I'm your partner in this. We're working together to try to do something great. And so I wanted to quickly talk about, it's getting to be that time. One project that I did that was student-led, and this was interprofessional education project. So I'll go through this fairly quickly. We did anatomy for interprofessional education because every program, like MDs and PAs and OTs, everybody needs to know some anatomy. So I thought, hey, let's get them all together and learn some anatomy. So what we did is every week, one of the programs gets up and gives a talk, not just about their program, but also about the anatomy we're looking at that week. And then we give everybody a case study. And this is a mixed group of, MD, nursing, PT, can't remember. These are old. But they all get together, talk about a case study, because that's kind of good fun. And then in order to understand the anatomy that we had in the case study, we did a dissection. So everybody got together and dissected in groups. And that was sustainable because in the first year, students came in as people doing the dissections. But the next year, some of the ones that were dissectors in the first year became facilitators. And then later on, some of the facilitators came back and helped design research studies. And then, the analysis would go off. And then now the facilitators from the year before would work as analysis, and some of the dissectors would become facilitators, and we'd have a whole bunch of new dissectors. And so this little pyramid scheme that I designed allowed the students to help in a really, really profound way to run the program. And so the students helped get ethics approval for research. They helped put in the surveys, pre and post surveys. They collected qualitative data. They did all sorts of interviews. They sorted everything, transcribed it. It was awesome. They helped in the data analysis. I have to tell you that normally I let the students do all the data analysis, and then because I don't, I have to be sure, I redo all the analysis, and we talk about how they differ. And then they presented at meetings. We had 7 different meetings for this one project that ran over a few different years, and we helped make papers and they help with paper preparation and review the papers. And just out of that one thing, we have 3 big publications from big journals. And incidentally, all led by students. These were all undergraduate students, medicine, health sciences, and health sciences. So that was pretty cool that that's the way that worked out. But that was basically all run by the students themselves. So my summary, so I don't go too long. First of all, anatomy is not bird watching. You have to, it's more than learning the names. It's learning about how they work and why they're significant. And most significantly in the second half is that, students are a resource, not a burden. If you can get around that as a faculty member and students acting like you're a resource and not a burden, which is also helpful, that will be transformative. And so I'd like to finish by just showing that all of these great people are doing most of the work, and I'm just that little guy in the back that gets to report on the work of all the great people that I work for. So work with, I say work for, maybe that's also true, but I work with. And so that's it. Thanks a lot for listening, and I'd be happy to answer any questions that you may have.
That's awesome. Thank you, Dr. Wainman. We've had a few questions come up,
Sure.
And if anybody else does have questions, feel free to message either Emily Boinsteel or myself just over Teams. But the first question we wanted to bring up with you was, what would be your key message to undergraduate students who are unsure if they want to even get into research in the first place?
Right. That's a great question. So I usually just give my own experience, right? And my own experience was that in the last year of my undergrad, I ended up meeting up with a biochemistry professor, and he had a project, and it was really well defined. I have to say, I was supposed to, go in and take, certain blood samples at a certain amount of time from some rats, and he gave me a chunk of brain, and I was supposed to extract an enzyme, and I kind of thought this is pretty good, because actually even then I knew I wanted to teach, and I knew that the only way I was going to get to teach a lot was to have a PhD. And then when I did the research, I was pretty jacked by the fact that it worked out, right? I actually got what I was supposed to find. It wasn't all fun, right? Like it was really bad, some of it, because I spent like a really long time doing the work, and I was sort of thinking to myself when I was doing it, maybe this isn't great, But then when I finished, and I thought, I actually learned something, and I accomplished this, and it added to the wealth of knowledge. I thought that was like the greatest thing ever, and he got to work. I thought he had the best job in the world, because I thought, he gets to work with like really smart people, except for me. Most of my colleagues were really smart, and they were fun to work with, right? And I thought that would be a pretty great job. And my daughter, has gone on to do her, she's doing her PhD now. And we have kind of the same discussions, like she's doing her PhD. How do I know I'm really going to love research? Well, you've already got 3 publications, honey. But it's like, and it's an evolving thing. I did my undergrad in biochemistry, and I liked the research in that. And then I transitioned into doing pharmacology. And then I did some straight, more biology. And then I did contaminants and reproduction. And then I do education research now. And so I have to say, like, I love research in every format. But when I'm doing it, even now, I question, oh, this is so hard. I feel like, oh, why am I doing this? And and when I actually finish it and publish it, I'm always happy. And it's like one of the few things that way. So what I think you should be aware of is it's not going to be fun every day. Right. And so definitely not going to be fun every day. But after the end of the month or after every 6 months, you're proud of what you accomplished, then you're built for research.
That's awesome. Thank you for that insight. I know Emily had a question come in
Sure.
that you sort of segued into. I'll leave it to Emily to ask that question.
Yeah, so we had one question come in that says, how do you motivate students to continue if their research isn't working out or if their publication doesn't get published? How do you kind of keep them motivated?
Well, that's funny. I think that's where the insight into things is like totally important. That it's because everything does. You have to say like research is a microcosm of life. Sometimes it works and sometimes it doesn't. Sometimes the third reviewer is an idiot, and and the review you get is like so off base and you're angry. And they're like, how come that didn't work? And I'm so angry. And I'm saying, great. Like, absolutely, you should feel that way because, like, I try to explain to them that you're angry because you care about what happened, right? And so if you didn't care, then what do you want to be? Less human? Do you want to feel less? No, like, yeah, why are you or get to them? Why are you unmotivated? Like, that's actually a different question. Why am I unmotivated? Oh, I don't think I'm getting anywhere. And then, often all my role is to say, yeah, when you came into this lab a year ago, 2 years ago, put your mind back there and tell me that you haven't improved since then. But we're so wrapped up in our own little world, like we don't have that perspective. And as a faculty member, you're like your everyday job, right? Especially with your research students, to say, look, when you came in here, you could barely tie your shoes, and as a researcher, and then now look at it, and just to give them some perspective. I think that's what you do, right? Because you got you're 3,000 meters up looking down. And I can tell you, it's just a perfect story just happened. Like, and it's really hard on the students right now because you guys are at a distance. And then normally I have like a parade, right, of people coming in to visit me in the lab, and because I worked with them for so long, and a couple of my students didn't get interviews into medical school this year, and some of them applied to graduate programs they didn't get into. Many did get in, and so they come and they're like devastated. And I'm like, okay, here's the thing you have to understand. I know right now it's really, really hard, but actually, you're young, you're really smart, and not getting exactly what you want exactly when you wanted it is not the worst thing in the world. I say, it's like you're not suffering from, you're having an existential crisis, right? That you feel like you're suffering through this thing, but this is normal. This is what happens. People apply 5 times to medical school. People apply, multiple times to graduate school. Faculty, I bounced around before I landed a faculty position. I have the same conversation with Dr. Mezel, I can tell you, and it's not, it's just life, right? But it's hard. I think the thing is that people tell you, if it's going to be fun every day, you'll never work a day in your life. What a lot of hooey, honestly. Like some days are just suck, some days are really difficult. And that's what makes the good days good, right? Otherwise it'd be like weather in California, nothing ever happens. And so when something does, and then you're devastated, right? Like, we have difficulty, so we'll develop resilience, and resilience is a muscle that you build up by being tested over and over again. Yeah, I can tell you that's absolutely going to be the case, right? That you're going to be tested over and over, and that's it. You just have to accept it. But I think it's hard because if you just talk to your friends, first of all, they're normally not going to tell you the difficult things. And secondly, they don't have that perspective, right? Like when somebody asked me how many students I taught. It's 24,000. Yeah, so you get some perspective after that. And I know lots of people who've had really difficult starts and done fantastically well, and then people who've had, like, you thought everything was easy for them. Yeah, and it wasn't. It was tough, and you find out all that stuff later. Anyway, I'm getting off topic, but is that sort of thing that might be useful to you?
No, that's a very good answer. Thank you. I know Robert has one more to finish us off for today.
Sure.
Yeah, just to wrap up, and I really like this question. And in your presentation, you talked a lot about the huge realm of anatomy and how much bigger it is than what we think it is. But if there's one message you had to give to students, say first-year students who are, just getting their feet wet and learning anatomy, what would sort of your main message be to them as they indulge in this adventure of learning all that anatomy has to offer?
It's not about the test. You guys, I know it's hard to accept, but you get so few really great chances to be with faculty like that you have that are really like passionate about what you're doing. Look, I had better things to do on a Saturday, but I totally respect and admire the faculty that you have that are trying to give you guys the best experience they can, regardless of the conditions. And so if you're focusing on that course is like, I got to get an 82, man, you are missing out, right? Because the course, we have to give you marks in the end. That's just the gig that we've got. But if you're young and smart and motivated, I know you got to write the test, but man, you're not going to have this chance. Like, you're just not going to have these chances again. Like, how many chances do you think you get to go into a lab with human anatomical material? Like, it's not probably even going to happen again for many of you. So if you're not grabbing that with both hands, and if you've got faculty who are that motivated that are answering your questions and providing feedback and setting up these conferences, like, that's the stuff that's going to turn out to be significant and important for you in the long run. So if you just limit your scope down to the worm's eye view, I'm just going to pass this test like it's a trial and you're just going to get through it, man, it's so sad, right? Anyway, well, that's what I mean. And not about the test, or the other way to be more positive about it is just grab this opportunity with both hands. Like, you have no idea, what that thing is that's going to work, for you. Like, the thing that's going to be like critical for you. Maybe this is it. Maybe this is it. And you'll only know if you engage like 100% and don't ask questions like, is that going to be on the test? Dr. McPherson, in the third slide on the fourth line, you said, is that going to be on the test? Life's not a test, right? If she said it was probably real important. If you have a question about how it actually works, then like, the faculty love you. If it's just, reducing it all down to, the way we can look at it on a multiple choice, right? That's painful, and so, those are, that's more than one answer to the same question, I think, but it's just engaging, right? It's just a question of actually engaging with the material rather than that reductionist kind of thing down to just a couple things on a test. You only get, like, you don't know it now. Like, you can't know this now, but you might never get that chance again. Like, when else are you going to see people, dissected so beautifully to learn all the anatomy that you have, or structure, faculty with that enthusiasm and that background? You might not have it again, right? If you don't take that chance and spend that time, then who knows? That train might not come again.
Yeah, I think the opportunity that we have here at Brock, and I'm sure at McMaster is very similar, but the opportunity that we have here for anatomy education is, as our dean put it, one like no other, and we just have to go at it with both hands. So thank you.
Well,
for
and I, I
sharing
felt,
this today.
and I felt fortunate to be, a part of that, right? To help get some of those specimens together for you, because I really believe on that, right? That's why the people, by the way, donated those bodies, so that the maximum number of people could learn the most they could from that experience. I mean, every time you walk in that lab, I hope people, though we have been doing little walking into the lab lately, but the point is that those people donated for no other reasons than completely altruistic reasons, so that you people could learn as much as you could from them. For them, that was the last best thing they could do with their life. That's like a transformative thing if you give a chance, if you think about it for a moment, right? So, okay, I'll get off my high horse now.
That's awesome. Thank you very much.
Okay, thanks a lot.
So without further ado, I'm going to pass it over to Miriam Chelsea Mustafa as we look at sort of the future for anatomy at Brock and some anatomy research insights. So I'll pass it over to them.